My name is Cassandra Keller. I'm an MSN student at Elms College, and over the next few minutes, I expect to explain to you what is active learning and show you a form of active learning that can be beneficial in the nursing education classroom. The first step in leading or instructing an educational journey for any student is identifying the intended learners and understanding techniques to help with instruction. Application of Bloom's taxonomy will aid in developing an effective learning plan or strategy. Bloom's taxonomy of educational objectives include cognitive, which is about or relating to knowing, affective, about attitude or feelings related to education, and psychomotor, which is about or relating to doing. There are 6 identified levels that aid in instruction, which include create, evaluate, analyze, apply, understand, and remember. The first 2 objectives support the cognitive section of Bloom's taxonomy, whereas the last 2 play more into the psychomotor and the doing aspect of the taxonomy. Throughout the rest of this presentation, we'll look at active learning and identify domains that will be highlighted. Wolters Kluwer explains that there are many important active learning techniques, one of which includes working NCLEX practice questions throughout your curriculum. This will have an amazing long-term benefit on your nursing students when it comes time to buckle down and study leading up to the big exam. Have the students answer example NCLEX questions individually and then guide and encourage a larger class debate on the correct and incorrect answers. Assessing pre-knowledge and working NCLEX practice questions encourages students to think about what they already know and stimulates interest in thinking and learning. This practice addresses the cognitive and affective levels of Bloom's taxonomy. Furthermore, assessing learning literacy allows for the educator to alter the teaching style to meet the needs of the intended learners. For the purpose of this active learning activity, we're going to look at seizures. What causes a seizure? Simply explain, anything that causes an interruption in the brain can cause a seizure. High fever, brain injury, hyperglycemia, hypoglycemia, stroke, alcohol withdrawal, drug withdrawal, and infections. By explaining this to the student pre-learning experience, they'll be able to better identify things they already know when it comes to seizures. Now let's take the learning experience a step further. What is the truth about seizures and epilepsy? Seizures are caused by rapid and uncoordinated electrical firing in the brain. The electrical impulses escape the brain and cause involuntary muscle twitching, movement, actions, or convulsion. Epilepsy is defined as having 2 or more seizures with the cause unknown. By explaining this to the student, you're further reinforcing what they think they already know, leading up until the next active learning experience. Here is the incorporation of the NCLEX questions. Presenting in a way that allows the student to first think of the answer and then opening it up for class discussion. Let's quiz ourselves, true or false. Seizures occur when there is an abnormal discharge of the electrical signals in the brain. A patient who is experiencing a tonic-clonic seizure is experiencing a focal or a partial seizure. By not directly providing the answer, it stimulates active thinking and learning and allows for the student to take in the knowledge in multiple ways. After utilizing the class time to stimulate active thinking and learning, we can apply the knowledge. This can be done by presenting case studies and showing the student how the knowledge can be applied to their practice. By knowing common causes to seizures, they can effectively attempt to treat the patient suffering a seizure and keep them safe during this time. Above is an example of a case study, which is another form of active teaching or learning that has been identified by Wolters Kluwer. This can be utilized to further reinforce the information that has been presented during the class time. Knowing my intended audience as undergraduate nursing students, I will wrap up the lecture by showing how application of the knowledge can lead to nursing interventions and how the information will guide their practice. Knowing this is an undergraduate class, I have provided simple nursing interventions that can be utilized with the patient suffering from a seizure. These interventions include never leaving your patient, protecting the airway, providing supplemental O2 if indicated, safety precautions, and medications indicated by the provider. Thank you for taking the time to watch my video on how I would utilize the education I have obtained to educate nursing students utilizing active learning strategies.